All right, welcome back, everyone. We'll give folks maybe one more moment, and then I'll turn it over to Shelly to introduce us and get us started.
All right, we're gonna get started because we have an amazing panel presentation and a very short time span. But this topic for this webinar is working with newcomer youth, and from the school-based health CAP program. Our panelists, our wonderful panelists, are here, and we're going to put a link to their bios in the chat as well. And we have Kenia, Kelly, Maria, William, Zarin, Kathie, and Naomi, and they will each be presenting a certain part of the topics today for newcomer youth. The objectives are here. It is how can school-based behavioral health support and services for newcomers, and then assessing and incorporating youth into school-based health centers, and procedures for newcomer school-based health intake when they're actually in the medical visits, and then identifying key stakeholders and resources in underserved areas. And I will now pass it over to Lauren.
Awesome. Thanks.
No disclosures.
No disclosures. So before we get started, we just wanted to kind of check the pulse on how everybody's feeling right now. This is something we like to do at the beginning and end of every time we come together. So if you wouldn't mind just answering these brief questions about how you're feeling at work right now. We'll give folks a moment to answer that poll, and then I'll turn it over to Evan to lead us in a brief mindfulness to hopefully collect us all and get us all in this space before we turn it over to the panelists.
All right. Hey, everyone. I see it looks like they're not, the stream of responses has slowed down a little bit, so I'll jump in. My name is Evan Holloway, and I use he, him pronouns. I'm going to lead us through a gratitude reflection, kind of mindfulness activity. I feel like we go through our day from meeting to meeting, thing to thing, personal life, professional life, and it's helpful sometimes to just pause and think of, recognize the things that we're grateful for. So I will ask you, you can keep your camera on if you want, you can turn it off, whatever you're most comfortable with. But I'll ask you to settle yourself in a relaxed posture, whatever that is. And as you do that, you can close your eyes or let your eyes kind of rest in a natural angle, whatever is most comfortable. Take a few deep, calming breaths to help relax and center yourself. As you do that, just be aware of your immediate environment, all the different things that you might smell, maybe you taste, that you're touching, things that you can see or hear, and say to yourself, for this, I am grateful. I'll let you focus on that for a second. When you're ready, I'd like you to bring your focus to those people in your life for whom you're close. This could be friends, family, a partner, a neighbor. I also think pets can count here. And say to yourself, for this, I am grateful. And when you're ready, I'd like you to turn your attention to yourself. recognizing that you are a unique individual. You have your own imagination, skills, your own ability to communicate, to learn, to overcome pain, and to celebrate life. And I'd like you to say to yourself, for this, I'm grateful. Maybe take 2 or 3 more deep breaths. And bring your focus back whenever you're ready. Turn your camera on and rejoin the group. Awesome. Thanks everybody for participating in that. Hope it was helpful to center yourselves a little bit.
Thanks, Evan. So we are going to turn it over to our panelists. Again, we apologize. We don't have time to verbally introduce everyone. Please take a look at the bios we put in the chat. But first, we are going to start with Kenia and Kelly from Castlemont.
Share my screen. Oh, hold on one second. See that okay? Okay, great. So hi, I'm Kelly Edyburn. I'm an assistant professor at UCSF and part of the behavioral health team at Youth Uprising Castlemont Health Center in Kenya.
Hi, good evening. I'm Kenia. I'm a bilingual clinician at YU Castlemont.
All right, so we're going to be talking a little bit about some of our programming and services and supports at Castlemont Health Center, but also hoping to frame it in kind of a more generalizable context. So no financial disclosures. So we're framing it within kind of a prevention model. So thinking about the idea behind kind of primary prevention being we're providing universal supports for all individuals in order to try and prevent mental health problems, reduce risk of exposure to traumatizing situations or circumstances. Secondary prevention being targeted to a smaller group of individuals involving early identification and targeted intervention. And tertiary being individualized and intensive services for individuals who have already been identified with mental health needs, and this being a much smaller subset. And so thinking of this pyramid as applying to newcomers specifically, we kind of structured our presentation that way. Keeping in mind that obviously we know a lot of newcomers, especially those who are asylum seeking or seeking other forms of legal relief to stay in this country, have already experienced a lot of trauma. So a lot of them do need additional supports beyond the kind of primary level. So we'll go into our tier 1. Kenya?
All right, so for tier 1, we've developed multiple supports and services. One of our most recent things that we did this school year, which we plan on adapting it and recreating every year, is the Newcomer Resource Fair, which we do about a week or 2 before the school year starts. We partner with Oakland Unified School District to have a lot of our kids come to our clinic next door to Castlemont to receive their vaccinations. And we also help them with registration next door at Castlemont High School. And this fair, we actually provide services with all different languages, different interpretations, translation services. We educate them a little bit about the resources that we provide here at the clinic, such as like confidential sexual and reproductive health. And we do some screening for, the things that we feel would be necessary for the school year. And it helps us determine what type of groups we will be able to develop throughout the school year based on the needs and what the families and children report they're currently experiencing.
And I think I saw Ms. Manzanares on here. So also shout out to our newcomer social workers at Castlemont, Ms. Manzanares and Ms. Blanca. They also do basic needs screening, as do all of the other OUSD newcomer social workers on this call. But so we also kind of identify that as part of the tier 1 supports that we kind of try to collaborate on with the school-based partners.
For tier 2, we've developed multiple supports and service groups, focus groups. One of the groups that we've had for a couple of years is the culturally adapted DBT group. We do provide this group in Spanish. The group that we just recently developed is called Círculo de Guerreras, and it's a psychoeducational skills focused and acculturation for young women. So we do a lot of like cultural norms, rituals. We're currently borrowing Miss Manzanares' room, and she has a beautiful altar in the middle of her room. So we've adapted that altar as one of our rituals, just to continue, you know, connecting our young participants to their cultures. This group, we've done multiple things. We started off with like group agreements. We did an introductory map. So we brought up a map, and then we allowed each girl to introduce themselves and go put a pin from the part of the world that they came from. And then they talked a little bit about their experience. So they talked about their immigration, the type of immigration, whether they came in a boat, a car, walking with family members by themselves, the length of their immigration journey, just keeping it very brief, right? We want to keep it trauma informed, so we don't want them to like disclose too many personal things because we want to have a small contained space. We've also collaborated with School with Their Voices group, which is another psychoeducational skill focus group, which I think Lauren mentioned that you guys will be going over that next week. We were able to modify this group to make it specific for women, and this group also helped us identify and educate women on different aspects such as like gender roles, socioeconomic status, and kind of like helping them integrate into the community. So it like really helped them understand how people in the United States see genders differently and the ways that they can identify themselves and socioeconomic status. So, learning about different ethnicities and different languages. We've had some other healthy anger groups, and we just continue to collaborate with the school. And we do a monthly meeting with Castlemont High School with our amazing social workers, just to continue collaborating to see what basic needs are needed at school and how we can continue to develop and modify our current groups to best serve our students next door.
And then at tier 3, we offer individual and family therapy using a variety of modalities and approaches that are described here, as well as case management and referrals to various social service providers. Kenia underplayed her role in creating that amazing newcomer registration and vaccination clinic at the beginning of the year. She brought together tons of community-based providers for that. And so the relationship building with providers in order to be able to provide those individualized referrals is really key. And as well as collaborating with legal service providers and medical providers, especially to provide referrals for gender affirming medical care. And we also do patient navigation and support, like help enrolling in Medi-Cal or connecting to other kind of services that can help families enroll in Medi-Cal. Letters for attorneys for documenting treatment, and input it at IEP meetings. So that's kind of a very fast overview of our services, and excited to talk and learn more with all of you later.
Awesome. Thank you both so much. So next we are going to turn it over to Naomi Schapiro and Kathie Rhodes to talk more about school-based health centers.
I'm just going to share my screen. Give me a second. Okay, can you all see that? Oh,
We can see it, Naomi, but
you can see everything. Okay, let me unshare and stop. I'm sorry, it just okay. Got it. On my desktop, sorry. Now, yes?
Perfect.
Okay, all right. So I'm going to start, and then Kathie will, I'm going to start about how one thinks about getting the newcomers into school-based health centers, and Kathie will talk about initial visits and follow-up. So first I wanted to talk about some of the things that impact the way we assess newcomers and kind of get them connected. And it's important to remember that there are varying fluency and literacy levels in what we assume is their native language and may not be their native language. And just to be more, a little bit more, just to give an example, when we started seeing a flood of newcomers coming up from Central America, from El Salvador, Guatemala, and Honduras in 2014, 2015, and it's ongoing, we didn't realize until we were actually in the clinic with young people that many of them couldn't really speak Spanish. And had very, we ask a lot of questions about sexuality and gender, and these young people would sort of look at us like we were from another planet, kind of, because it just wasn't part of their vocabulary in what they knew. And so then we realized, whereas some of the youth we were talking to had, came from cities, had maybe had mental health contact, had, might have been on contraception already. The questions were no big deal. And so just to realize that we can't assume what the language even is because of a lot of historical discrimination and discrimination here against Indigenous people. They say they speak Spanish for a variety of reasons. A lot of different familiarity with Western therapy techniques and terminology. Even saying something like confidentiality, we had to start talking about privacy because a lot of people didn't understand that term. And that also, we'd ask young people how they were feeling, and they would go, "Oh, fine, I'm fine." And we realized as we dug deeper that there's a lot of both culturally and historically influenced reasons for folks to endorse trauma symptoms. Partly just intense violence, intense ongoing violence. Families telling them, you're better off not talking about this. And so the suggestions are to really check your assumptions, to engage in respectful curiosity. My experience with working with adolescents, which I've done thankfully for a very long time, is they kind of like being cultural ambassadors if you can really develop a relationship, to really check out things, to explore somatic symptoms as a route to exploring feelings. We talked about this a little bit in the first hour discussion about, what happens before you get that headache? What happens when you can't sleep? What are you thinking about when you get that stomach ache? What has just happened, or what's going on? So just really, that can be a pathway. And then offering interpreters, but also expect that clients in small immigrant communities may know the interpreter, may not trust the interpreter. We found, for example, with some of the youth from Guatemala, that not only were they, we thought, oh, there's a mom community here, but actually depended on what town they came from. It depended on what their religion was. It depended on a lot of different things. There were actually like many different communities in a very small space, and people often did not trust each other. So just important to check that out. In terms of continuing that assessment, we like to do a lot of screening and mental health screening, things like that. A lot of young people are worried about the safety and impact of disclosing their trauma, both because of gossip within their community here and their home country, but also the impact on status and safety here, and the risks of, injury or death to family members at home if they said something that was going on, but are very open to learning coping skills. Love to learn about deep breathing, muscle relaxation, grounding techniques. We did some interviews with young people who said, "Oh, yeah, I taught those to my friends." It's a really great way to make a connection. And so just suggesting flexibility in group activities, which probably people will talk about later on, and really thinking about general discussions of physiology and the impact of trauma, rather than having people say what their particular trauma was, talking about happy and difficult memories, and teaching, again, brief coping skills, even in primary care visits. So having, on your screen, maybe a bunch of different PDFs that you can just pull up and teach something really quickly. This model that you see on the right was developed by Raul Gutierrez, who was at La Clinica, now is at the General and UCSF. And there's an open access link to getting the whole article, in which this is highlighted. But basically thinking about registration drives, in various ways, thinking about maybe doing a brief, if you have a flood of newcomers coming in, thinking about kind of some more visits where you just see them for 5 or 10 minutes. You register them in the classes, maybe you see them, like, you just ask them really brief questions. Were you detained at the border? Do you need any legal help? Did anything bad or scary happen? Would you like to talk about it more? We found actually just asking those simple questions ended up in a higher rate of behavioral health referrals than kind of going through all the screens that we would go through after. And Kathie's going to go on and talk about what actually happens when you get into a new patient appointment.
Thank you in advance to Naomi for advancing the slides for me. I'm Kathie Rhodes. I'm a nurse practitioner at La Clínica de la Raza, which is a large community clinic based in Oakland with 8 school-based health centers. I work at the one it's called Hawthorne, which is in the Fruitvale neighborhood and linked with UPA, as well as open to the community, takes care of 3 to 19-year-olds, and the one at Oakland Technical High School, which takes care of kids at Oakland Tech, but also kids at Oakland International High School, which is just a couple of blocks away. So I was asked to talk about how La Clinica's school-based health centers, what do we do with newcomers to take good care of them? So I kind of boiled it down to 4 things that I feel like we do. We, first of all, identify that they are a newcomer because they come to us in different ways. We document on the problem list. We offer robust services as much as we can, and then we follow up. Next slide, please, Naomi. Okay, so people come to us in different ways. Often at my 2 clinics, I know it's a newcomer before they get to me because at Hawthorne, we get a lot of referrals from OUSD when newcomers try to register their kids and they need vaccines and they need the health clearance form. So they'll be on my schedule as a newcomer. At Oakland Tech, we get Oakland International High School sends us all their kids who need vaccines. So I'll know that it's a new patient who needs vaccines, and I'll find out that way. But also sometimes at some schools in the past, some of our sites have done we call them adolescent screening visits, ASVs, which is pretty much what was mentioned on the last slide Naomi showed, where we'll have health educators that go into a classroom, or sometimes we try to do a whole grade at a school, or if we know there's a group of newcomers, we'll do the newcomers. And we kind of have several people and they do these short visits and screenings, identifying people with needs. So however they come to us, once we know it's a newcomer, there's some additional information we want to gather beyond the information we would get just on a non-newcomer new patient, somebody who had Kaiser who just transferred to us. So I don't know if you can see it, but I tried to put in there a screenshot of the newcomer progress note. We have templates in our electronic health record, and we have a special one for newcomers, and it leads us through asking like the immigration history. I don't know if you can see on here, but we put in here what country they came from, when did they arrive, why did they leave their home country, how has it been for them since they got here, how did they arrive, were they detained, did they come with anybody or unaccompanied, who are they living with now, who did they leave behind in their home country, have they had any schooling in the past. Usually they've had some, but a lot of teenagers have had several years of interrupted schooling where they maybe went through 6th grade and then they dropped out and now they're in 10th grade or 11th grade and they haven't been going to school for 5 years. Legal concerns, almost all of our newcomers have legal concerns, and trauma history. So we gather that information, knowing that they're a newcomer. And then next slide, please, Naomi. It looks like you have like some kind of editing tool where you're going to be able to edit it.
Not sure what happened. I'm going to stop share and share again, I guess. Sorry.
Okay.
Yeah, I don't know something kind of got crazy.
That's okay. I can just talk and then you'll show me the slide in a second.
Yes.
Okay. So next one after that is what you do with that information. So you've gathered the information, and now what we want to do is put it on the problem list. The problem list, for those of you who aren't in clinics and dealing with charts, every person, all of us, also with our own personal health provider, we have a chart, a medical record, and in the medical record is a problem list, which is a list of issues that we've been seen for in the past. So for anybody who is a newcomer who comes to us, we put on their problem list that they're a newcomer. We use these billing codes. They're federal, government billing codes. We don't have any control over what they say, but we use one that's Z60.3, which is acculturation difficulty, which may seem judgmental, but we don't think about the difficulty part. We just think about the acculturation part. So we put that on everybody's problem list who's a newcomer, and then we put a little template, which you can see on the right, in there with some basic information. Where were they born? When did they arrive here? What grade are they in here? Did they have their labs? Did they get referred to a lawyer? Did they get referred to a counselor? Was their trauma screen positive or negative? And what's their insurance status? We put that in there, and then it's saved. And then any provider who sees them later, whether it's a social worker or another medical provider, If they hover their, mouse over the problem list or click onto it, they can see this information, which is really helpful because it lets you follow up. There's another code we use for unaccompanied immigrant youth. Some of the reasons we use these codes are for quality improvement measures, also for grants. So there's different reasons to use them, but the biggest reason is just to communicate with people who come after you. Okay, next slide, please. Once we've identified the needs, which are many, we try to meet them as much as we can. So almost everybody who comes to us needs vaccines. We do labs on people that we're going to be the primary care provider of. We base them on this American Academy to Pediatrics Immigrant Health Toolkit, which is a fantastic document, very approachable for anybody who works in a school-based health clinic. I recommend checking it out. Raul Gutierrez was very instrumental in creating that. Behavioral health, mental health. So some of our clinics have enough capacity where they'll have it be an opt-out situation where every newcomer gets referred to the social worker or the therapist, and they do their own screening, which is wonderful, but not all of our clinics can do that. Others are much more limited in their capacity. So then the medical provider will do some screening and refer people who we identify as somebody who needs some therapy. Case management, huge need, very high rate of food insecurity, housing insecurity. Almost everybody from Latin America that we're seeing needs legal consult. One of the biggest things that we try to help people with is getting Medi-Cal, because if they don't get Medi-Cal, which is health insurance for people under a certain income level, if they don't get Medi-Cal, they can't meet a lot of these other needs. So that's a big thing, and it's done differently at different sites according to the capacity they have. Some of our sites have a case manager who sits down with people and applies with them, which takes like 45 minutes to an hour. So it's a big time commitment. Other sites don't have that, but they have figured out other ways. Everybody pretty much needs to see the dentist. Many of our patients have never seen a dentist in their life. Optometry if needed. We schedule them for a physical. They come in, we check their vision, their hearing, go over lab results. And then finally, follow-up. I feel like this is one of the biggest areas that we're able to take better care of people than they do at a lot of the big busy sites, because we have the capacity to see people back every 1 to 3 months until they're all caught up with their vaccines and kind of stabilized. And the big sites just really often don't have capacity in their schedule to do that, but we do. And so we become a really important part of their support network. And it just feels really good. So anyway, that's what we do at La Clinica to take care of our newcomers. On to the next person.
Thank you so much, Naomi and Kathie. And so lastly, I'm going to pass it to Will Martinez and Maria Jimenez-Salazar.
Hi all, good afternoon. Can you see my slides? Awesome. So very briefly today, I'm going to share a little bit more about the importance of expanding services through collaboration by building community partnerships between school providers and community providers, and really building off this idea that school-based mental health clinics or clinics are an amazing resource, and yet there seems to be a disparity within the state. So I'll provide a little bit of an example through what we've seen in the Fuerte program in terms of how these collaborations can facilitate delivery of services to newcomer youth. I'm so happy that everyone's here and that I get to share this with you today. So just a very quick overview, and I feel like I'm preaching a little bit to the choir here. You probably know better than I about the availability of services and whether or not your schools have a school-based health center. But I just wanted to start off by providing a quick snapshot of what it's looking like statewide. So going from north to south here in California, there are quite a bit of concentrations of school-based health centers within urban hubs, but overall, there's really not that many school-based health centers, especially in rural areas and rural counties. So what you can see here in this map is in the Bay Area, in LA, and in San Diego, there seem to be concentrations, and those are the darker orange. But really there's a disparity. So what do we do about that, right? How do we expand the reach of services when we know that not all schools have the same ongoing partnerships or access to school-based health centers. So I've been doing a little bit of reading and trying to follow conversation around this topic. And what I keep hearing is the importance of community partnerships, of developing wellness teams that are really well represented, both by folks and stakeholders within the school, that represent families, that represent students, and that also represent different community actors. And these include mental health providers out in the community, but it also includes folks within systems that we know interface with young people, such as the juvenile justice system, community leaders, child welfare. And so what can we do to build that out, right? You're probably like, yes, of course, that makes a lot of sense, but how do we get there? And so just kind of taking this idea of community partnerships, there are some best practices out there that kind of speak to how this looks in practice. And I just wanted to share a little bit of a snapshot. So it is very well recognized that the foundation to this multi-tiered system of care is a strong community partnership between school providers, between community providers, and family and student stakeholders. So that's at the very foundation of the different services that young people, that newcomer young people might need. And in order to build out these community partnerships, we can start by inviting and having dialogue between community providers and school teams, right? So at a very basic level, we're starting to collaborate in the delivery of services. And we can invite both actors to take part in the direct delivery of services. We can also develop memorandums of understanding where we're really delineating what each person will deliver. So what do folks within the school, what are they doing in this delivery? And what are community providers doing? So that way there's not so much of a redundancy or overlap, but everybody has a clear role in what they're providing to newcomer youth. And we can also consider adopting models like the community school strategy, which has, really expanded within Oakland Unified and seems to be working really well. And so building community schools where community providers are directly situated within the school, and where there's funding that's happening for mental health services at the school level within that institution. And I think there can also be benefit to creating a directory of services, right? So collaborating so that students within your school have a directory of everything that is available for newcomer students, for immigrant families, access to both legal advocacy as well as mental health services, social services. And I think those are just some recommendations. I wanted to provide an example of, well, who are the stakeholders and how do we reach them, right? So what we know is that advocates for immigrant young people within schools are not necessarily always the provider. Yes, those are advocates, but we can also find advocates and folks who are like librarians who maybe have a lived history of immigration, or coaches, right, who maybe know young people and feel really strongly about advocating for immigrant rights. So inviting them to join the conversation and to take part in the delivery of services is also really important. And I'm going to share a little bit about the program, just as an example of how we've done this. So the Fuerte program is a school-based mental health prevention program for newcomer youth, young people who've been in the US for 5 years or less, typically participate in groups. And these groups are delivered through partnership between community mental health providers and school team members. And I say school team members because we're really intentional about inviting anybody at the school. So it can be a librarian, it can be a coach who is invested and interested in learning this model of care, and who has an interest in providing care to immigrant young people. What we have observed through the Fuerte model is that having this direct partnership between the community providers and between school teams really enhances or makes it more possible to recognize and identify young people who could benefit from the program. Of course, folks within the school see these young people regularly, know what's going on. And so that also really promotes communication between the between the program facilitators and the young people on a regular basis. It also really promotes the exchange of ideas, right? So instead of being just an external provider who's coming in with maybe our viewpoint and our way of doing things, it promotes this conversation of like, well, what could really benefit students, and what are students bringing up, what's going on within this circle, and how can we maybe tailor the group to meet those needs. And finally, I think it really promotes the coordination of services so that it meets the academic programming and calendar in a way that's more seamless. And we're seeing that the delivery of the program during the school day is actually ideal. So I think it would be impossible to do that without coordination and partnership with school providers. So that's just a snapshot and all I had prepared. So looking forward to some conversation. Thank you.
Great. Thank you so much to all of our panelists. Thank you, everyone.